They looked at the weight of the people self-reported through the survey and looked at people that were considered normal weight, those who were overweight, and then those who were considered obese. And those that were obese were already dealing with some of the issues that they looked at earlier, and that those seemed in that group to be more pronounced, like weight gain. Weight was not affected the same in everyone during lockdown. You might think that we all gained weight, but it seemed that those that were obese were more likely to have increased weight, and the same ended up being shown for stress.
A global survey conducted during the early months of the COVID-19 lockdowns confirms that many people experienced dramatic changes in health behaviors, prompting them to consume more junk foods and cut back on physical activity. In turn, this drove anxiety levels higher and disrupted sleep. And those who were obese may have fared the worst. On today's Sound Living, stress eating and weight gain during the pandemic. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman. K-State Research and Extension Nutrition Specialist Sandy Procter says the study gives us a snapshot of how people reacted to the changes caused by the pandemic. Sandy, this was a study that was done early on during the pandemic, April and May, reviewed in June, and really we didn't see it until I think December after it came out in the journal Obesity. But there are some interesting findings there, especially early on in terms of weight gain and stress eating.
It really is an early snapshot of some of those behaviors that just sort of landed on all of us. And the thing I thought that was fascinating about this study is, even though it was very early on, the researchers did a global survey of people in countries that had had some sort of government lockdown or curtailing of socializing events. And so they had thousands of people sign up for it, and in the end there were 7,700 participants. And so it really was a big early snapshot of the effects of COVID lockdown on people all around the world.
One of the things they found, and maybe one of their most interesting findings, was the fact that people who had obesity suffered the most.
It really seemed to point to that those who already were suffering from obese situations, they looked at the weight of the people self-reported through the survey and looked at people that were considered normal weight, those who were overweight, and then those who were considered obese. And those that were obese were already dealing with some of the issues that they looked at earlier, and that those seemed in that group to be more pronounced, like weight gain. Weight was not affected the same in everyone during lockdown. You might think that we all gained weight or that it affected us all the same, but it seemed that those that were obese were more likely to have increased weight, and the same ended up being shown for stress. It was more likely to be noted in those who were obese.
As you recall, the dietary guidelines mention the fact that we just need to move more, and I think one of the findings was the fact that people were not moving as much. There was not as much commuting, not as much time spent outdoors, and that had an impact on weight gain as well.
And if we can recall back to this early lockdown period, I truly feel like we were all just sort of like suspended. You know, even if you didn't have a routine where you went to the gym and you worked out this many days a week and it was very structured, you probably parked in a parking lot and walked a certain distance and went into a store or made a point of parking further, as we always talked about, from your workplace. Everything sort of ground to a halt, and this study pointed out that some of those, and this was, again, very early on, so not all of those next steps had been seen yet, but we're seeing that some of those initial sort of changes were more profound in groups that really needed healthful support, in the obese group particularly.
There was also initially that craving of comfort foods, sugary foods, and things that would just really, in essence, make us feel better.
Right. And, you know, they really were very clear on looking at what types of foods were more increased, and there were some healthful changes across the board. For example, many of us began cooking more at home, and for the most part, that was healthier and less availability of our kind of ongoing enemy, fast food. But for some people, they saw that immediately there was a decrease in vegetables, and you can envision people who, maybe at work went out and had a salad for lunch or something. A real decrease in vegetables, and also I remember too, we weren't able to get out and access those fresh fruits as often, fresh fruits and vegetables. We were talking about pantry meals and things that had a longer shelf life, so our intake of vegetables across the board was decreased. So many things happened initially, and it took past this study for us as a whole, and I'm not sure we're there yet, to be able to sort of right some of those things that were cast upon us.
I think we always kind of look at health from the extension standpoint of being holistic, and as part of that we saw mental wellness suffered, anxiety increased, there were sleep problems, so really our entire bodies suffered during this pandemic.
Yes, and we have really, really seen more on that outside, again, of this study with the mental health crisis and the stress that has surrounded the sheer magnitude of the COVID crisis, and then all of the snowballing effects of it, whether that's employment or people's incomes decreased or cut drastically, the ability to work from home and manage kids in school from home, all of the things that were really just thrust upon us have definitely increased the mental and physical stress on us. And then to have some of these opportunities to actually combat that, some of the ways that we do that through, healthful sleep, good exercise, getting outside, some of these things aren't available or as available to everyone across the board. So it's really become noticeable that it's very targeted, some of the effects of the pandemic stress on different parts of the population.
There were some bright spots. Even early on, it was not all negative. There were some increases they found in people who were doing more exercise. Some people were losing weight. Some people were eating more healthfully. So there was also kind of, I guess, a mixed reaction in a sense.
There were even, 10% people who actually found that their sleep quality improved. And those who found themselves without their long commutes actually found that they had more time to exercise. It was maybe a change in how they did it, but there was more time in their day for healthful activities, whether that's cooking at home or exercising. So there was a mix of positive and negative effects, and those varied between those different weight categories too. And so oftentimes the result would be similar for those who were considered normal weight and those who were overweight, and might be slightly worse or different for the obese category.
This was a study that was done, as we mentioned, back in April and May. As time has gone on, things have probably changed, but there's going to be some takeaways even from this. What are some of the things that you think may be takeaways?
I think if we're smart, we're going to keep a closer eye on our ability to be aware of our own self-care and to realize that there may be all sorts of opportunities and things that we can buy, subscribe to, or go to support our health. But when it comes down to it, it really has a lot to do with personal awareness of our health and what some of those different factors are. That sleep is a huge part of our health. It's been kind of overlooked and maligned, and I think that this pandemic has really brought that out. And that exercise is important even if we aren't able to get to the pool or the gym, that it's important to make time for it in whatever ways that we can. I think we're going to find, too, that a lot of what we are able to do can be supported by things not necessarily together in groups. There will definitely be some real joy, I think, in regrouping and getting back together when it's safe to do that. But knowing that a lot of the things that keep us healthy can be obtained through online or distant type meetings and support that we didn't realize or hadn't really given thought to because it just wasn't necessary before. And I think the stress from this pandemic, whether it's economic or the residual health effects of those who have actually had the virus, and certainly the job stress and changes, maybe the schooling stresses, those things are going to continue. Even once we may get back to a semblance of normalcy with our lifestyles down the road, hopefully. But some of those stressors and those effects of stress will continue. So the emphasis that communities are placing on really having resources for mental health and identifying some of those situations where people are at risk and assisting before a crisis, some of those things hopefully are going to become more commonplace, and there will be resources and attention paid to those in an ongoing way.
People who made positive changes during the pandemic, do you think that a lot of those will possibly continue?
You know, that's been a really interesting point for research already, is how many of those changes that we've made will continue. And there's a real hope among we food and nutrition types that the cooking at home trend will continue. Certainly people will rebound and go out to eat more when it's safer to do so, but hopefully people will remember that they have these skills and how good home-cooked meals and the joy of preparing and sharing a meal with family, and hopefully again soon a wider group of friends, remembering just how supportive and really healthful that can be. So there is a lot of hope that some of these good trends will continue, and a lot of the attention to self-care will also continue. And some of the things that are simple enough, like remembering that healthy sleep is a big part of staying well, and that physical activity doesn't have to mean you have a membership someplace, that it just simply means moving more and figuring out ways that we can put that into our schedules, and remembering that we made time for it before, and if we get busier again, or if things revert back to more of travel and commutes and some of the things that take up our time, that we remember to put some of those things that kept us healthy still at the forefront.
We also talk a lot about resiliency, and I think that we've probably all had more than enough lessons in resiliency during the pandemic, but that, again, another coping skill that will help in the future.
Well, I think so, and I think as a nation we're going to learn a lot of things about ourselves, too. One of the things that was pointed out in this article I thought was really interesting, they found out in the U.S. that when this first started, there wasn't the decrease in physical activity that there was in other countries, but the reason for that was not what you might think, that we were, more focused on health. It was that in the U.S. we have less physical activity than most other countries anyway, and so when we went into lockdown, it didn't negatively affect our health as much because we were already lower than a lot of people. So I think there's opportunity for us to really continue to take a good long look at our personal role in our health, and to really step up whose responsibility it is to take those first steps to be healthy.
Well, and as we mentioned, this is something that is going to have a lasting impact, and the need for more research is certainly there and will be ongoing, I'm sure, for several years. This is one of those case studies that's probably going to be featured for years and years and years.
It's really interesting. They have some classic nutrition studies that were done during some of the early days, particularly in World War II, when there were famines and there were starvation periods due to blockades and things in Europe. And so some of those studies are classic because they're snapshots in time, and they can look at people who were affected by those. And I suspect that, not maybe to that extent, but I suspect some of the studies that look at stress and look at weight change or physical activity change, that look at mental health and resiliency, as you mentioned, I think some of those ongoing facets of health are going to continue to be studied in those snapshots once we mercifully move past some of this and we're able to look back at this period in time and see some of those effects and what made the difference in people who were able to stay healthy, and what were some of the lasting effects for those who suffered from more of the effects of the different periods of time that we've gone through.
That's K-State Research and Extension Nutrition Specialist Sandy Procter. More information on health and nutrition programs across Kansas is available at county and district extension offices and online at ksre.ksu.edu. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman, and this is the K-State Radio Network.